Hi, chemists. Use these slides to fill in the 3.3 chunk concentration and dose notes worksheet. You should have it open in Notability already and do a split screen. If you don't, pause and go back to get that from Schoology. And then pause anytime you need to fill in the blanks if you need more time. The guiding question, how do pharmacists use mass and volume? I can take notes and identify the parts of an oral suspension of medicine using a fill-in-the-blank notes sheet. You know the pharmacy at Walgreens or the hospital or maybe Target or Walmart? The pharmacist's job is to fill the doctor's prescriptions. They organize and prepare medicines. They give advice to patients about their medications. They check for interactions which may be dangerous for patients on more than one medication. You see, the pharmacist makes about $124,000 a year. So it's a pretty good job. And if you want to know more about how to become a pharmacist, there's a link there you can click. So you would go back to the slides in Schoology if you want to see that. For small children, pharmacists often make an oral suspension. It might come in a bottle like this and it's a liquid. They make the oral suspension by adding water to powdered medication. It's very important the pharmacist measures both the volume of the water and the mass of powder accurately. If either one is wrong, the medicine will be the wrong concentration and the child will get the wrong dose of medicine. So the word oral means mouth and suspension means a solid dissolved in a liquid. Take a moment to fill in the blanks. These blue words are the ones you're looking for to fill in. And here you see a picture of an oral suspension. It's kind of thick and sticky. Next week, you will be a pharmacist. You will put your measuring skills to use by making an oral suspension according to a prescription for a baby. Before we can make the medicine, we need to understand more about oral suspensions. An oral suspension is a type of mixture. It's a solution in which something is dissolved in a fluid. Solutions always have two parts, the solute or dissolved solid and the solvent, the liquid. To help you remember those words, I'm going to just let you know that salt and water can also make a solution. And salt is the solid and it's also called the solute. And if I put salt into the water, I can see it floating on top here, but when I stir it, just takes a minute and it disappears. Now you know this water would taste salty because the salt and the water still are just salt and water. They've just mixed really evenly. And the water is called the solvent. Now salt sounds a lot like that word solute. So solute and salt sound alike. Salt is a good example of a solute. And any solid that's dissolved in a liquid is called a solute. And the liquid is the solvent. So on your notes, label the boxes that are on this diagram. The solute, again, is the solid, and the solvent is the liquid, and the solution then is when the two are together. And look carefully at this picture of a solution. Here is a solute particle, like maybe this is the salt that has spread out in the water that I just showed you, and then the water itself is the solvent. Some other solutions might be like Kool-Aid, a fruit-flavored drink. It's a solution, and it can be made by dissolving powder and sugar in water. I'm sure a lot of you have had it many times. Now, which is the solute and which is the solvent when we make Kool-Aid? Take a moment to think about it and try to answer in your head. A little hint would be, again, the word solute kind of sounds like salt. And salt was the solid that I shook into there. And here the Kool-Aid powder is kind of shaking into the water. So the Kool-Aid powder is the solute and the water is the solvent. And by the way, water is probably the most common solvent in the world. The word concentration, try saying that a couple times, concentration. It can mean thinking really hard, but in this case, it measures the strength of a solution. We asked in the Ignite this week whether you preferred a strong, concentrated coffee or a weak coffee. Or maybe you don't drink coffee, so then think about instead, what about a strong, spicy food, which is very concentrated in spice, or a mild food that has very little spice? So concentration measures the strength. A solution that is not very strong in solute is called dilute or weak. And that is when there's either more solvent or less solute. Either way can make the solution dilute. When my kids were little and if we made Kool-Aid, I usually added extra water, and that way it was more dilute and less sugary for them. And they didn't know the difference because they hadn't had it the other way. So in these cups, you see that the amount of solvent is staying the same. So the amount of water is really the same in all of these. And so what's changing is the solute. And in this end, we see there's less solute, which is the Kool-Aid powder in this case, less solute. So this side is more dilute. All right, reading over here now. A solution is concentrated or strong when there's more solute, the solid, or less solvent, the water. And in these pictures, again, the solvent is staying the same. So I'll underline more solute, less solvent. That can make it more concentrated. But the solvent is staying the same in these pictures. But on this end, we see there must be a lot more solute. And that makes that cup on the end, the darker one, more concentrated or strong. So the question says, how could you make a solution more concentrated? And use the word solute or solvent in your answer. So for example, if I have this cup or one of these on the more dilute side of the spectrum, how could I make it more concentrated? How would I move it to looking more like the other end? And use the word solute or solvent in your answer. Remember to pause if you need more time. So next week, like I said, you are going to make an oral suspension. And so we're going to watch this video, which is an instruction video for nurses who have to make oral suspensions for babies. Let's just take a minute to make sure you understand. Now, adults can take a tablet like this, but babies can't do that. And so a pharmacist has to make this medicine into a suspension that the baby can swallow. And sometimes we add sugar and other things to make it taste better. But for yours, you're just going to do the medicine and the water. And both of those need to be measured carefully to have the right concentration for the baby. We're going to watch the first 4 minutes of this video. And as you watch, pause and take notes on your notes sheet. And make sure you're thinking about the steps for making the oral suspension, because you'll be doing this next week when you do the Be a Pharmacist activity. So I'm not giving you a whole lot of instruction for what to take notes on. Just when there is a step in making the medicine, pause and write that down. I'll move myself up out of the way and we'll watch it right here.
Preparing oral medicines. To give babies safe and effective treatment by mouth, the medicine must be prepared and given correctly. Giving the right dose to a baby can be challenging. The doses for a baby are quite small and can be difficult to accurately divide.
The word dose, she will say a lot, DOSE, and that is the amount of medicine that the baby is supposed to have each time it takes medicine. So the dose must be accurate in order for the baby to be healthy.
They can taste bitter, and some amount may be lost if the medicine dribbles out of the baby's mouth or is spit up. This video will show how to prepare 2 commonly prescribed antibiotics and some helpful tips for giving it to the young baby. Calculating dosages correctly takes time and good math skills. However, using a dosage chart is very helpful for saving time and reducing mistakes.
Now watch how they weigh the baby, and they put the blanket on the scale first and then zero it in, so that when they add the baby, they get only the weight of the baby. Like when we zeroed in our lab scales with the weigh boat on top.
This baby is sick and needs amoxicillin. Doses for babies are usually calculated based on the baby's weight.
She's zeroing it in.
Start by getting an accurate weight. The baby weighs 3.4 kilos. Amoxicillin comes in powder for suspension, tablets, and capsules. The powder preparation is easiest. Add water according to the direction on the bottle to make a standard dose. If that is not available, make it easy for the mother by preparing a suspension using tablets. Check the dosage chart. To make the suspension for our 3.4 kilo baby, you will need to mix 4 tablets in 60 milliliters of clean water.
Now notice how they go over from one side, the weight of the baby, and then they go down from the top. And you'll be using a dose chart as well. It will look a little different than this, but you'll practice it later in this worksheet.
Remove the tablets, then crush them in a clean piece of paper with a spoon or in a mortar and pestle.
So you might say for your first step to check the dose chart to see how much medicine the baby needs. And for the second step, grind up the tablets.
Grind the tablets into a fine powder. Carefully pour the powdered medicine into the bottle. Add 60 milliliters of water that has been boiled and cooled. Don't use hot water. It will make the medicine useless. Shake the bottle to mix the medicine well. This preparation allows a little extra medicine to cover for spills and losses.
So there's the oral suspension. It is a solution, but it's a little bit thicker and needs to be shaken every now and then. So compared to like the salt water, it's a little thicker than that. So that's why it's called a suspension.
The baby needs 1 teaspoon, which equals 5 milliliters, twice a day for 5 days.
So that's the baby's dose, 1 teaspoon. And they need that dose twice a day for 5 days.
If you can give the mother a syringe, show her how to draw up the dose.
Now you have a syringe in your chemistry kit, and we'll learn how to use those next week, I think.
She can also use a teaspoon. They are generally 5 milliliters. Check the volume by filling the spoon with 5 milliliters from a syringe. This baby has a serious eye infection and needs erythromycin. As before, get an accurate weight for the baby. She weighs 4 kilos. To make the suspension, you need to mix 7 tablets in 75 milliliters of clean water. Take out the tablets and grind them to a fine powder. Now, add 75 milliliters of water that has been boiled and cooled. The baby's dose is 1/2 teaspoon of medicine every 6 hours. Always label the medicine with the name of the baby, the name of the medicine and the dosage, how much medicine to give the baby, how often to give it, and for how many days.
We're going to stop there because then they go on to explain how to give it to the parent and teach the parent to use the medicine, which is more than we need. So I will continue. All right, so fill in on your note sheet the blue words again. In oral suspensions, the solute then, which is again the solid part, it is the drug or medicine to be mixed, and the solvent is the water to dissolve the drug. And so solute is that powder that they were grinding from the tablets. Solvent is water, and together they make a solution. But we call that solution, like you see here, an oral suspension. Didn't really circle the right part of it there, but the pink part. So doctors and pharmacists work together. The doctor makes a diagnosis, which means they find out what's wrong, and writes the prescription. And that is what and how much medicine to take. And then you bring that to the pharmacist and they fill the prescription, which means they look at it and they put the amount of medicine needed for all the doses into one bottle. So an adult might get a bunch of tablets, just the right amount that they need, and a baby would get a oral suspension. Now the dose, again, is the amount of medicine to take each time. Most of the time, you need to take many doses of medication, and you should always take it until the end, as much as the doctor said. For example, the doctor may prescribe 2 doses per day for 10 days, and even if you feel better, you should always take the whole prescription. And here's what a prescription might look like for amoxicillin. That's the medicine. And the dose is 10 milliliters or 0.6 grams, which would be dissolved in that. And that's, again, one time. And then the frequency means how often do we take this? 2 times per day for 10 days. And this one is for an ear infection. So on your worksheet, these are what you're looking for to answer those couple of questions that are on the side. You might want to pause now and look at that, because I don't have those questions here. So you are the pharmacist. A doctor prescribes 10 doses of amoxicillin to treat a baby's infection. You must prepare the oral suspension to provide the correct dose based on the baby's body weight. Here's a preparation chart with grams. Use it to do the examples on your note sheet. So we'll click to see patient A done for us. And now, by the way, these questions that you're going to fill in here, you're going to use to answer the questions in the next assignment, 3.4. That way you can see if you get the answers right. So the first thing we need to do is look for the baby's weight. And it says that patient A, patient is the word for the person, their weight is 2.4 kilograms. And so I'm going to look up in the chart here for where 2.4 kilograms falls. And if you look, you'll see that this one says 1.0 to 1.9. So that's low, that's lower. 2.0 to 2.9, yeah, 2.4 is in the middle of that range. So that is the amount I want to use. And I'm going to look then to see that I need 1 gram of powdered medicine in the bottle for that baby. And then with this next arrow, I see I need 40 milliliters of water. So it's my job as the pharmacist to measure carefully grind the tablet, measure 1 gram out from that, and then measure 40 milliliters of water and put that in my medicine bottle. That will come next week. Now you complete patient B and C on your own. Please complete the vocabulary review on your own, and you will use your answers for those questions in assignment 3.4. So once you have them written in your notes, you'll go to 3.4. You might want to do that right away so you don't have to find this again when you're not sure where it might be. I hope you will look at it to study, but it might be easier just to go to 3.4 right now after you fill it in and then enter those answers into the Schoology assessment so you can get your feedback. Thanks.